What are common October scan artifacts? Imagine getting a detailed map of the eye's internal structures, but sometimes that map has little errors or distortions. These are called artifacts in optical coherence tomography scans, or October scans. They can happen for many reasons and might affect how doctors interpret the images, especially when diagnosing conditions like glaucoma or macular degeneration. Understanding these artifacts helps ensure accurate diagnosis and treatment. One common artifact is motion artifacts. These happen when a patient moves their eye or head during the scan. Even tiny movements can cause the image to look blurry or shifted. Sometimes, you might see duplicated layers or a smear effect in the scan. Motion artifacts are quite frequent and can make measuring the thickness of the retinal nerve fiber layer or ganglion cell layer tricky. They are often hard to spot but are a major source of error, especially in quantitative analysis. Shadowing artifacts are another type. These occur when something blocks the October light beam, creating a shadow that hides the layers underneath. Common causes include floaters in the vitreous, bleeding, pigment deposits, or even the iris partially blocking the view. Shadowing can obscure critical areas like the optic nerve head or the macula, which are essential for diagnosing glaucoma or age-related macular degeneration. Proper pupil dilation and careful repositioning of the machine can help reduce this problem. Vignetting or cut-edge artifacts show up as a loss of signal at the edges of the scan. This often happens when the iris partially blocks the scan or if the October device isn't perfectly aligned. Usually, it affects the outer parts of the image and doesn't interfere much with measurements of the central retina. However, it can reduce overall image quality. Technicians can minimize this by carefully positioning the patient and adjusting the device. Misalignment or off-center artifacts happen when the scan isn't centered on the fovea or optic nerve head. This can be due to poor patient fixation or technician error. When the scan is off-center, measurements of the central macula or nerve fiber layer can be inaccurate. To get reliable data, retaking the scan with proper alignment is often necessary. Out-of-register artifacts are caused when the scan shifts up or down, missing parts of the retina. This usually results from movement during the scan. Correcting this involves repositioning the device to focus on the area of interest and ensuring the scan is centered properly. Degraded image artifacts happen when the scan quality is poor overall. This can be due to patient cooperation issues, technical problems, or media opacities like cataracts. Although near-infrared light used in October can penetrate some opacities, poor focus or alignment can still produce blurry images where retinal layers are hard to see clearly. This makes measurements unreliable. Factors like high myopia can increase the likelihood of artifacts because of elongated shape and altered anatomy. These changes can make October interpretation more challenging and sometimes lead to artifacts that affect diagnosis. In clinical practice, recognizing these artifacts is crucial. Technicians need to be trained to spot errors and retake scans when necessary. Doctors should also compare October findings with other clinical assessments to confirm diagnoses. Being aware of these common artifacts helps prevent false positives or negatives, ensuring patients receive the right care. Overall, October scan artifacts are common but manageable. Knowing what they look like and what causes them helps improve image quality and diagnostic accuracy. If you or a loved one are undergoing October imaging, remember that your care team is trained to identify and correct these issues, making sure your diagnosis is as accurate as possible. Always consult with your specialist for personalized advice and interpretation of your scans.